Okay, infections transmitted by arthropods. One of the problems is rickettsia, which is Rocky Mountain spotted fever. We don't have that in our area. The Rocky Mountains through Colorado, that's where they have lots of problems with that, which is transmitted by fleas, ticks, or mites. What we do have up in our Sierras here is Lyme disease, and Lyme disease is the most common tick-borne disorder in the U.S. It comes from their small black ticks, deer ticks, and so what we want to focus on is prevention, that people really look at themselves after being up in the mountains and make sure they don't have any ticks on them, and wearing long clothing when you're hiking, lightweight long clothing if it's a hot day, and even tucking your pants into your socks so there's no way as you are walking through stuff for those ticks to get underneath your clothing and onto you. Ticks burrow into the skin. Their head goes into the skin because they suck blood, and that's how the germs then get into the person. Mammal bites and scratches. This is a very common pediatric problem, both from animals and from other little kids, and so you see it especially on kids under 4. Wound care, our biggest thing is to wash. Wash well with soap and water. If it's a fairly bad bite, fairly deep, we may very well want to irrigate it with normal saline or LR, where we're going to use a syringe and with pressure really push into there to try and wash this out. Depending on how likely it is to infect, there's a good chance I'll put the child on prophylactic antibiotics if they, really are concerned about it infecting. Whenever you have an animal bite, you need to think about rabies. Certain animals are much more likely to carry rabies than others, and we'll talk about rabies later. But rabies is a concern because once you have symptoms of rabies, it's too late to treat it. You need to do the injections before you have symptoms. And then we also want to make sure they have a current tetanus shot. This is your DTaP or Tdap. Diaper dermatitis. This is common, and especially in the hospital where we put kids on antibiotics, you're going to see this a lot. Now, the pathophysiology, we used to think it was just from urine because urine gets so strong smelling, but as urine breaks down, it makes ammonia, which has a high pH. That high pH activates certain enzymes in the feces, and then those enzymes are what really do some damage and irritation to the skin. So our goal is to keep the skin clean and dry. Some kids will also get it from harsh detergents. If the family uses certain detergent in their washer, they may need to change to, there's a couple of detergents that are much gentler that are made for little kids. Deft, I know, is one of them. I think there's another. Or this can be chemical irritation, and often this comes from diaper wipes, and that's why you'll see at children's they have the little pink netting things that we actually put water on. They're dry initially because a lot of kids will react to the perfumes or the different chemicals that are in the pre-moistened diaper wipes. So now, nursing considerations, we want to keep the skin dry. We want to avoid that wetness. We want to maintain a normal pH, so frequent diaper changes. We want to put barrier creams on so that the moisture in the diaper and the feces in the diaper doesn't get onto the bottom. And open to air. If we've got a pretty bad diaper rash, opening it to air will really help often. And then Candidus, which this is a yeast rash. It looks a little different than a normal diaper rash. It's very red, and the edges will look like they just would peel off if you rubbed your finger along it. There's some really good pictures in the textbook. Eczema is not a specific disease exactly. It's kind of a category of diseases. And with eczema, you get this really itchy, little broken down areas in the skin. So the main management for it is to hydrate the skin, to relieve that itching, to try and reduce flare-ups, because this does tend to be a chronic thing that people get, over and over, or the inflammation that they've got going on with it, and then to prevent any secondary infections that get in there. Atopic dermatitis is a specific type of pruritic eczema, so an itchy eczema during infancy. This tends to run in families. It's often associated with other allergies, such as food allergies, allergic rhinitis, and asthma. There are 3 forms which divide up by age. Infantile eczema is 2 to 6 months. Childhood eczema is over 6 months, so after the infantile. And then pre-adolescent and adolescent is 12 years and up into adulthood. And this has the same kind of symptoms: relieving that itch, hydrating the skin, reducing the inflammation, and preventing or controlling any secondary infections. Seborrheic dermatitis. This is something that can be chronic. It's kind of a recurrent inflammatory reaction of the skin. We don't really know why. The most common place or time we're going to see this on little kids is cradle cap. They get this, it's just sort of a crust on their scalp. It can also be on the eyelids, along the nasolabial folds, which, it's kind of from the crease from the nose down to the mouth, or along the ears. The best treatment is to remove the crusts. They do have anti-seborrheic shampoos to try and keep it under control or treat it. On cradle cap, you usually don't need a special shampoo. Usually just a standard gentle baby shampoo will work, but a lot of parents are afraid to really wash the hair because of the fontanelles. So if we teach them it's okay to wash the hair, if they put the shampoo on and lather it up and just leave it on there and let it really soak in and soften up that cradle cap, and then wash it out and use a soft baby brush to try and get it out of the hair, that usually will get it under control. Acne. This is very common in adolescents, and what happens, the hair follicle and the sebaceous gland that produces oil around that follicle get germs in it. It's the acne bacteria, and it gets infected, and it gets a big red lump. You can also get just the little whiteheads and the blackheads. These are comedones, and it's comedogenesis. Those still have the white is from our white blood cells, and then debris from the germs or cell particles, but they haven't gotten inflamed the way the big red ones have. The way to treat it, over washing the face doesn't necessarily help that much because it dries the skin out. So washing a couple times a day is really what's recommended, but over just general overall good health is going to help. And then there are medications, and here's a list of medications. The top one that's in blue is Retin A, and this is the first 3 are topical, and then the last one's oral. And this kind of stops that comedone creation, the comedogenesis. It can irritate the skin though, and we want to tell people to use sunscreen and avoid the sun, because it will predispose them to sunburns. Benzoyl peroxide, this is antibacterial. It won't bleach their skin, but if they put it on at night and lay down, it will bleach their linens. And then there are many different topical antibacterial agents that stop the growth of that acne bacteria, and these all we need to teach people about using sunscreen and avoiding exposure to the sun. Now, Accutane. This is the one that's oral, and it's very effective once somebody takes it, it pretty much stops them from getting acne ever after that, not just while they're on it. It's got a lot of side effects though. It should be prescribed and monitored by a dermatologist. Probably the most concerning side effect is that it can cause depression, so we would want to watch the child, make sure the family's kind of watching them, that they're not showing any signs of depression or suicidal thoughts. It also needs to have periodic blood work because it makes changes in lipids and blood sugars. And the biggest problem with it, it is contraindicated for pregnant women. It causes very severe birth defects. So if we have a teen girl who's on it, we need to make sure if she's sexually active, that she is using good and safe birth control. In fact, they generally will tell a girl they want her using 2 forms of birth control. And that's the end of this part.